Hi everybody, my name is Erin Bovia, and my project for RAD 310 was on multiple sclerosis, otherwise referred to as MS. I really didn't know a whole lot about multiple sclerosis, but I did learn a lot of information, and hopefully you will too, and we'll go ahead and get started. Multiple sclerosis affects the central nervous system, which of course is the brain and the spinal cord, and it is the breakdown of myelin surrounding the nerve. As we learned in our textbook, and I'm sure you've known this from your other courses, myelin surrounds the nerve and helps transmit nerve impulses from the brain to wherever it needs to go, and then vice versa. Now, when in MS, this myelin is damaged, and you are unable to transmit those nerve impulses as effectively, and you'll have scar tissue and inflammation, which will lead to it could lead to complete loss of function depending on how severe the myelin is damaged. And this picture on this slide, I have a comparison of a normal nerve, which is on the top, and you can see the myelin intact around the nerve. And then this is a nerve damaged by MS, and you see this myelin is torn, the nerve is actually exposed, and with the inflammation that would come with it, it would definitely be harder to transmit nerves as effectively as you would with this normal nerve. Okay, now MRI is the most sensitive for imaging MS because it is most sensitive to demyelinization. It is, it's safe, it's accurate in obtaining evidence that points to MS because mostly it's in the brain and the spinal cord. There is an MRI in particular, it's a FLAIR, F-L-A-I-R, FLAIR MRI, which stands for Fluid Attenuated Inversion Recovery. And this type of MRI is used to diagnose MS and to actually follow its progression because it shows the total cumulative progression that MS has had from start to finish. And what FLAIR MRI does is it focuses on the lesions and plaques that are in areas close to fluid, like, for example, the ventricles. They contain CSF, cerebrospinal fluid. So that FLAIR MRI enhances the visibility of those MS plaques in those areas that usually have fluid close. Now I have this first image. It is a sagittal view, and you can see that I have pointed with these arrows to the plaques that are visible. So there's 4 of them there. This second image is an axial view, and if you look at these arrows, they're actually pointing to these oval looking plaques. Now this is very indicative of MS because these are what's known as Dawson's fingers. They are oval looking plaques that are perpendicular to the body of the lateral ventricles. So it's butting up right next to that ventricle. So that's very indicative of MS. Okay, and finally I have a coronal view. This is actually a view from a FLAIR MRI, and you can see that these are the ventricles, and these are kind of enhancing those areas that are close to the area of fluid. So that would be used to both diagnose MS and also to see how far it's come since it has started. Okay, there are currently about 300,000 to 500,000 people in the US alone that have been diagnosed with MS. And diagnosis is actually correct for MS about 90 to 95% of the time. There is no clinical test or anything that that you're looking for that says, oh, this person has MS. You usually confirm it with MRI. Sometimes they do a lumbar puncture, and then just talking with the patient, and that's pretty much how you diagnose MS. So diagnosis is, correct about 90 to 95% of the time. And about 200 people are diagnosed with MS every week, and worldwide there are about 2.5 million people affected with the disease. there is no known cause for MS, but there are several theories as to what can cause it. One of them is that it's an autoimmune disease, an autoimmune reaction to the body fighting the myelin. There's some antigen in the myelin that the body attacks, but it's unknown what this antigen is, and how to stop it from happening. Some scientists believe that there are viruses and bacteria that may trigger the development of MS later in life. For example, Epstein-Barr or chlamydia, measles, and even pneumonia. If you contact with any of these viruses or bacteria before the age of 15, studies show that you have an increased possibility of developing multiple sclerosis later in life, according to some research. And then geographical location. Sometimes studies show that there are more incidences of MS in areas farther away from the equator. So scientists believe that it may be vitamin D. Like the more vitamin D you have, the less likely that you are to develop MS. And it may be soil or water toxins. So that they take into effect when trying to figure out MS as well. Now, it is most common among the Caucasian population, women a little bit more than men, and usually it occurs to people between the ages of 20 to 50. Rarely happens in Asians and African Americans. It's very rare in those races. Signs and symptoms. Now, there are several stages or classifications of MS. There's relapsing and remitting, which is actually the most common stage of MS. A person may have symptoms that last a few days to a week, couple weeks, and then the symptoms pass and they go into remission, and then they have time to recover and maybe hopefully repair some of that damage, but then the symptoms return. So that's kind of have it, you don't, you have it again, kind of ongoing damage, but you have time to repair your body in between those stages. There is secondary progressive. In this classification, there's actually no chance to repair or rebuild any damage. It's kind of boom, boom, boom. You have symptoms. They kind of get a little bit better, but then you have the symptoms again, and there's no break in between flares. Primary progressive. Is you worry about disability of a person. It becomes more severe and there are no relapses or remissions. There's no improvement in between symptoms. And then finally, progressive relapsing is physical disability as well as possible mental disability. So those are kind of the four classifications of MS and a little brief definition. But like I said, relapsing and remitting MS is actually the most common. And also, it really all depends on the location of the lesions or plaques that determines your symptoms. For example, if you should have a plaque in the cerebrum or cerebellum, you would have, balance problems, speech issues, coordination problems, and tremors. Whereas you might have a completely different set of symptoms if it were to occur in a different part of the brain. But generally, a lot of people with MS experience fatigue, depression, moodiness. You could have nystagmus or diplopia, which is double vision. You can have trouble swallowing. You can have spasms, pain. So there's a lot of symptoms that are possible, but it really all depends on where in the brain your plaque is that determines what your symptoms are. Multiple sclerosis was actually discovered, I think, in like 1868. So we've known about multiple sclerosis for 150 odd years, but there is still actually no cure for multiple sclerosis. There are treatment options available to hopefully at least slow the progression, if not manage the symptoms. So there are several classifications of medications. Most of these medications are given either via injection, which either under the skin subcutaneously or in the muscle intramuscularly. Either that or IV. So all these medications is probably that's it, IV or injection. But the interferon beta medications, these hopefully reduce the inflammation and increase the time in between attacks. And hopefully it decreases the severity of the attacks as well. And there are several medications in each class that, differ in dosage and frequency. But basically the whole classification is the same. It wants to reduce the inflammation and make sure that there's a long time in between outbursts. Glatiramer or acetate medications. This one is more composed of amino acids that mimic myelin that hopefully will suppress the attack of the immune system. So hopefully they're blocking those white blood cells, those T and B cells that go into the brain and the spinal cord and cause the demyelinization of the nerves. So that's what those medications are about. And then methoxytrone. This is for more advanced MS stages, such as like secondary progressive and primary progressive. This is administered via IV, and it's it's for the more severe cases that don't that aren't responding to the other types of medications. Now, steroid medications, they feel, are good for short-term use. If you have an acute exacerbation, taking a steroid might decrease the inflammation. It's not really suggested for long-term use, it's just for that particular time. So kind of immediate relief for flare-ups would be for steroids. And then physical therapy. Hopefully, if you continue to use your muscles, your ability to transmit those nerve impulses will not be impaired further. So that's the kind of the thought behind physical therapy. And like I said, none of these medications are cures. It's kind of try to manage the symptoms as best as you can. So that's pretty much it for treatment and prognosis. And I believe that's the end of my presentation. So hopefully you all learned a lot about MS. I know that it was hard to sift through all this information into a couple slides, but hopefully it was put together in a fashion that you could understand it well. And hopefully you didn't tally up how many times I said the word because I know it was a lot. But yeah, hopefully you learned a lot, and I look forward to listening to everyone else's presentations. And I'm going to go ahead and sign off. Bye.